The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, thank you for joining us today. We will get started here momentarily while we wait for attendees to file in. Hold tight and we'll get started in a sec. As a reminder, this webinar session will be recorded, and we will be sharing the recording with you all post-webinar. Be on the lookout for that. I think we'll go ahead and get started. Ethan, I'll let you take over.
All right, perfect. Thanks, Christian. Good morning. Thanks for joining, everyone. Let's get started with a round of introductions. My name is Ethan Franklin, and I am an account executive at ESRI, specifically working on ArcGIS Indoors for healthcare and hospital systems. I'm very excited to spend some time with you this morning, as it is my passion to enable organizations like yours with indoor mapping.
Good morning, everybody. My name is Georgie Tucker. I'm an account executive on the Health and Human Services team here at ESRI. I am also a registered nurse and have actually spent the last 12 years working in hospitals throughout California. In my role currently at ESRI, I really strive to make a difference by enabling health leaders to positively impact the communities that they serve through a deeper geographic understanding of how everybody's health is linked to location. I'm excited to be here with you today to discuss the importance of location intelligence within the healthcare sector. I believe that this is going to be a very insightful and exciting 60 minutes.
Good morning, everybody. This is Jonathan Garrido Leque, Solutions Engineer for the Health and Human Services team. And I am here to help you to leverage the power of Indoors spatial analytics for your organization.
And good morning, everyone. My name is Chris Olson. I'm the GS Administrator for Loma University Health. I'm excited to be here as a guest and to show everyone the great work that we're doing at Loma University Health and all of the new things and great things that we're doing here. So happy GIS Day to everyone as well, and looking forward to it.
Great.
Thanks, everyone. By way of an agenda, we will be starting with examples of ESRI technology in the healthcare industry. Then Georgie will share with us current challenges that hospitals face, including some of her experiences as an RN. Next, we will discuss our vision of what the smart hospital means, followed by detailed solutions that our indoor mapping can provide, complete with demonstrations. Then we will be honored to hear from Loma Linda University Health, a world-renowned university and hospital, on their projects and priorities. And lastly, we will have a Q&A session, so please type your questions in as we go along. But first, let us start by asking a question of each of you. Christian will help us review the answers.
Yeah.
We would like to know, what part of the world are you calling in from?
All right, the poll is launched, so go ahead and take a moment and submit an answer.
So that is, you calling in from the US and Canada, Latin America and the Caribbean, Asia Pacific, West Asia, Middle East and Africa, or from Europe?
Let's give it about 10-15 more seconds. Give everybody a chance to answer. All right, we'll go ahead and close that and share results, and a nice mix from all over the world here today. It's great to see.
Wow, great.
Yep, let me go ahead and hide that.
Perfect.
We'll resume. Here we go.
All right, well, welcome everybody from all over the world. Having worked in the healthcare industry as a registered nurse GIS is not something that the nurses and doctors commonly talk about within the hospital, so I think it's important to explain the role that ESRI plays in the health sector. For decades, ESRI has worked with federal, state, local governments, as well as public and private healthcare organizations from all over the world. These healthcare institutions are collecting vast amounts of data, more now than ever before in history, which is wonderful. That's really great. But this data actually needs to be utilized effectively to improve patient safety and satisfaction. At ESRI, using the science of where, organizations can address these social challenges, identify vulnerable populations within their communities, and promote community resources, as well as support global disease surveillance. ESRI helps these communities battle homelessness as well as the opioid epidemics. We also help organizations identify the optimal location for the next clinic by taking into consideration where their patients actually live. We map polio vaccinations for philanthropic charities, as well as provide tools for epidemiologists to understand the importance of their location-based data.
Georgie's exactly right. We're no stranger to the challenges facing all those that work in healthcare, and we've helped healthcare organizations and governments map economic and social determinants of health for years. But we feel now it's the time to focus specifically on what goes on inside the walls of a hospital as well, and how our technology can help. From what we've seen, there are significant improvements that can be made. The current system is broken. There is no common operational data format for organizations to manage their buildings, space, or resources. Currently, 2/3 of organizations in the US rely on pen, paper, CAD, Excel, emails, and just other disparate project files to try to connect the dots and manage their buildings. This leads to isolated and siloed departmental workflows and inefficient processes. These inefficiencies create unique challenges. In addition to that, the US population in 2019 is nearly 330 million people. To serve those 330 million, we have just over 6,000 hospitals, and 1,000 of those are federal hospitals. So only about 5,000 community hospitals, with 930,000 staffed beds to serve this growing population. These numbers show the level of demand for quality healthcare is the root of many challenges facing hospitals today.
Now, further addressing these challenges, I think that it's safe to say that we've all at one time or another been lost in a hospital. In fact, not only do patients spend wasted time looking for their appointment location, staff also spend valuable time navigating lost patients. 4,500 hours a year are spent by hospital staff showing patients around. And now that is 2 full-time employees worth of simply navigating. Now, I used to say that I spent 50% of my time caring for my patients and the other 50% of the time looking for the equipment to care for my patients. And while that may sound ridiculous, being able to locate these life-saving devices are critical. And to that point, this equipment is extremely expensive and should always be accounted for, but unfortunately, that is not always the case. Hospitals are also extremely high stress points, and they're vulnerable to crime and violence. Safety and security for patients and staff must be a top priority for hospital directors. And we all know that the core mission of every single hospital is to provide outstanding patient experience, even during difficult situations, providing opportunities for patients and visitors to feel comfortable and safe from the moment they step into and interact with the facility is of the utmost importance. And lastly, facilities management is an extremely complex process. These are some of the busiest people that I've seen within a hospital. Not only do they need to understand the building's design, but they also have to have an understanding of the equipment, both medical and non-medical, that's being utilized within. One of our customers said it best: facilities run everything. And it's true. The cost containment is a primary focus for hospitals, and proactive maintenance is actually 14 times more cost effective than reactive maintenance.
And that's why we envision a smart hospital ecosystem that not only addresses these challenges, but acts as a platform for connecting all your data and business systems. Hospitals need to create what we call a common operating picture of their space. This common operating picture integrates all the different business systems that hospitals are using today with a platform for location intelligence. So smart hospitals are safe and secure from emergency planning to incident response. That means knowing where critical assets are and how to quickly access or deploy those in a time of need. Smart hospitals are well run and efficient with one shared view to manage operations and maintenance. They also use the latest offerings in technology and stay compliant with all regulations. This leads us to our next poll question. Which of the challenges that Georgie mentioned do you think your organization is currently facing? Please mark all that apply for this question here. That could be the cost of getting lost, could focus on lost equipment, overall facility management, safety and security, or patient satisfaction.
Yep, let's go ahead and give everybody some time to answer. Seeing a good mix of answers come through. We'll give it a few more seconds here. And we'll go ahead and close that and share the results. So the number one challenge chosen was facility management, but each challenge that we discussed received quite a bit of votes. So good.
Wow,
mix.
great. Yeah, great feedback there. I think that's in line with what we're seeing too. So yeah, thank you everyone for that great feedback. I would now like to introduce ArcGIS Indoors and what it is from ESRI to help with these challenges. ArcGIS Indoors makes floor-aware assets accessible through 2D and 3D web maps and through mobile apps that are indoor location aware. That means they're compatible with indoor positioning systems. ArcGIS Indoors acts as a system of record and system of engagement, creating a digital twin of your hospital. Now we're going to demo 5 different use cases for indoor mapping for hospitals. The first addresses that cost of getting lost with wayfinding. ArcGIS Indoors allows everyone that works in or visits your facilities to have turn-by-turn directions, indoors and outdoors, across your campus. Mobility affects patient care, and nearly half of patients and visitors get lost in hospitals, and like Georgie said, thousands of hours a year are spent by hospital staff simply showing patients around. Directions with ArcGIS Indoors can be to an individual patient or space, patient room or space, or an actual point of interest like a fire extinguisher or some other type of individual asset. ArcGIS Indoors gives everyone the ability to use a web app or their mobile device to find their way. Now I will demonstrate wayfinding in ArcGIS Indoors through through the web map, mobile app, and also even on a kiosk. So here is a healthcare campus web map using ArcGIS Indoors. We have the ability to view and search all our buildings and floor plans in a dynamic map. We can select a building and using a floor picker, choose a floor plan that we wish to explore. We can also view our buildings in 3D as well as just 2D. Let's see that here. We can search for items in our map. In this case, we'll look for a hand washing station. We can save it as a favorite location, share it as a URL link, click 311 to submit a service ticket, but we'll talk a little bit more about that later, or even get directions to it. We also have tools like the Explore tab to categorically sort our building units and assets. We can choose safety and security and view these types of assets, or we can choose places and things and choose from these available units. If we select outpatient care, it will take us to that location on the map and outline attributes about that space. Let's wayfind from a patient room to this outpatient care center. So we'll type in a patient here, patient room here. And ArcGIS Indoors can even use landmarks to provide these directions. So we'll see here that it's routing using stairs. If this is a concern, maybe we are pushing a patient in a wheelchair. We have multimodal options, and you can go up here and select wheelchair and use elevators instead. You can see it changes the route there and stays dynamic with the floor that you're currently viewing. Now I will show the native ArcGIS Indoors app for iPhone and Android. Let's get that queued up here. So you can see in the mobile app, we have a blue dot accurately representing our position indoors, using in this case, a Bluetooth beacon-based indoor positioning system. This app is ideal for hospital staff to have downloaded to use. The map that is being used on the device can be an internal map with information just for staff, or we can create a different map for visitors to use through their browser. Using this app, you can identify points of interest, share it with a colleague. You're also able to save it as a home location on the mobile app as well, and even integrate appointments on your calendar into the app. This app also supports wayfinding, so users can search and route to indoor locations, either directly from that calendar integration or normal search tools. ArcGIS Indoors also supports maps on a kiosk. So here's an example of that. This could be placed in a lobby or a waiting room for the public to interact with, and it supports the same features you saw in the web map. You can search, explore. You're also able to wayfind, and this application can even be branded for your organization. So you would have your own colors, logo, everything. They would look custom for you. All right, so on to the next example. Now we're going to talk about live asset tracking and visualization, and integration with RTLS systems, or real-time location systems. The average medical facility houses numerous pieces of extremely expensive equipment, which are vital to ensure patients receive the highest quality care. When these machines and devices are lost, patients cannot be effectively treated in a timely manner. On top of that, federal and state laws require preventative maintenance on every piece of equipment. The clinical engineering department at hospitals are required to report inspections back to the government on a month-to-month basis. Many of these assets, like IV pumps, ultrasounds, and ventilators, are mobile and can be moved around the hospital or lost. Many hospitals don't have effective ways of locating and managing this equipment. So this is an asset management dashboard that gives viewers the ability to see both fixed assets, like fire extinguishers and first aid kits, as well as track the location of assets streamed live to the map. When opening this asset management dashboard, you see we have a map of this facility on the left and applicable assets within the map view on the right. And we also have the ability to toggle the floor plan and select the correct floor that we wish to view. We can select actual moving assets. In this case, these are security guards, and be able to view the name of that security guard in this dynamic dashboard. This also tracks high-value equipment like IV pumps and wheelchairs. We can see the exact location streamed to the map of this IV pump. This allows for that common operating picture to be created, so users with the right permission can view the location of assets required for their job. Not only can it show the quantity of each, you can also view service states. In this example, the assets that require maintenance in the next 30 days are visible. These can be selected to show where they are located currently. This eliminates the need to search an Excel spreadsheet to remain in compliance or risk lost assets that lapse in maintenance. Now I'll turn it over to Jonathan for the next part of our segment.
Thank you, Ethan. Oh, thank you. Yeah, I had some problems with the audio, but thank you, Ethan. That was an amazing demo. Indeed, really, we can see how Indoors integrates critical information for hospitals. But now let's talk about how Indoors can help hospitals to face some of the challenges they have regarding capacity management. We understand that no matter the size of the hospital, most of them will face capacity management challenges. For example, one of the impacts of a bed capacity problem is an increase in emergency departments' waiting time. This indeed is an experience that we all have had and that shapes the concept that people have about hospitals. On the other hand, surgeries are canceled or postponed due to capacity problems, sometimes even at the last minute. This not only impacts on the patient and staff satisfaction, but it's also costly. One clear example is the increase on patient length of stay. Indoors can offer to a hospital a complete operational view of their facilities. The results are reduced reliance on agency staff, optimized overtime usage, and decreased staffing cost variability. Now let me show you how this works. So what you're seeing here is a capacity management dashboard. You can see indicators that are key for many stakeholders at the hospital. All these values can be filtered by any of the facilities. If you go ahead, there we go. We can filter for facilities and floor level. You can see quickly that I have 32 vacant patient rooms in the first floor of this facility. And I can filter the map visualization so you can see where those vacant rooms are located. I could even filter those rooms that now are in the process to be cleaned. So we can plan ahead what will be the potential capacity of those rooms in the future. On the right side, you can see information related to operating rooms. As you know, operating rooms are one of the most expensive rooms in the hospital. So to monitor the utilization of those rooms is critical. You don't want to have rooms that aren't utilized. Here, for example, we can see that more than 92% of operating rooms are being utilized in this hospital. We can filter the operating rooms by status, and we can see where those vacant rooms are located. I can get a list of those rooms, and even I can zoom in and check how long they have been not utilized. But think about all the possibilities that Indoors, as your spatial Indoors framework, opens for you. You can see where patients with infectious diseases are located and find if there are vacant isolation rooms across your facilities. This indeed would help you to prevent more cases of hospital-acquired infections. These are a couple of applications on how Indoors could help your organization to be more efficient. Now, Ethan has some great material to share with you regarding another use case.
Great. Thank you, Jonathan. ArcGIS Indoors can also be used to augment and enhance existing asset management systems that you have currently. Healthcare facility managers are busy people. Since ESRI has an enterprise software platform, you can integrate third-party systems like ServiceNow into ArcGIS Indoors. This enables all your facilities and service technicians to have that common operating picture of your space and a spatial tool to increase operational efficiency. I would now like to walk you through a workflow, starting with the crowdsourcing of a high priority work order, in this case we'll say from a physician, all the way through its resolution, while also demonstrating direct integration with ServiceNow. So in this example, Andy Stewart will be our physician and notices an operating room light is broken. He will decide to report the incident by using the ArcGIS Indoors mobile application on his device. So he will use an indoor positioning system, will locate his exact position in the operating room, and he'll report it by clicking that 311 button to launch an incident form in ServiceNow. In the ServiceNow application, he fills out the request with his name, and the incident actually already contains his geo-referenced indoor location brought over from ArcGIS Indoors. That means he doesn't need to enter where he's located. He can enter a short description of the incident. He'll say here the light bulb is broken. And he can add additional details if you would like. And to finalize the report, he takes a picture and it, of course, is attached. Once the incident is saved, he can return to the ServiceNow homepage, view his incidents reported in order of oldest to newest, and you'll see here that incident 10057 was recorded here at the bottom. So now the hospital facilities manager notices Andy's recent critical report by going into her ArcGIS Indoors web application. From here, she can drill into reported incidents and locate the ones with the highest priority. She sees this incident 10057 listed at the top and clicks on the incident to pull up more information. She realizes that no one's assigned this incident. So she'll go into the incident information and launch 311. This takes her to the ServiceNow incident page, and she can assign it to one of her workers to go fix that light bulb. So in this case, she'll assign it to one of her electricians, Andrew Ock. Then she can see this update on the ServiceNow incident page. Perfect. So now Andrew Ock will receive a mobile notification on his device. This will notify him of the incident in the operating room. He can click on the shared URL in the message, and it will direct him to the location of the incident in ArcGIS Indoors. So we'll do that here. So Andrew will use his ArcGIS Indoors wayfinding capabilities to generate a route to the incident. So as you watch here, you can see it like in the wayfinding example, you'll see Andrew's exact location traveling the path of the route. When he arrives at the location, he clicks on the incident to view the details. Perfect. Andrew can launch ServiceNow from ArcGIS Indoors to resolve this incident. So here he'll give it a resolution code of solved. He can take some notes. He'll type in that the light bulb needed a replacement. And then of course he's able to take that final picture of the light now working. We'll show that here. Andrew saves the report, and now he can go into his incidents and see that it's completed and no longer there. Click on incidents. And it's gone. So the facility manager now can also see that the incident is complete by bringing up ArcGIS Indoors and drilling into critical incidents, which is what we'll do right here. She's able to see in the table and on the map that the incident's been resolved and it's no longer showing. This demonstrates ArcGIS Indoors for work order resolution and that integration of ServiceNow. Now I will turn it back to Georgie for our last use case and demo.
Thank you, Ethan. Now, that integrated work order system, that's just amazing. It would have saved me a lot of time and duplicative work processes when tagging broken equipment and then having to go insert it into the computer system as well. So that definitely is a time saver for staff and everybody involved. So let's talk a little bit about safety. As I am well aware of, and you guys are too, treating patients is far from the only concern faced by hospitals and staff within hospitals today. With $3.6 billion in federal budget cuts announced last year in 2018, hospitals really need to prioritize their security measures to combine effectiveness with cost efficiency and strive for the best return on investment. And to address the increasing risk of in-hospital violence, Hospitals need to prioritize prediction and prevention of crime just as much as how they would respond to and manage those incidents. Solutions to achieve this will include more advanced and integrated technologies such as ArcGIS Indoors. Now, our solution engineer, Andy Stewart, created a great dashboard that I would like to share with you. Here's our security monitoring dashboard, and in the upper left side of this dashboard, you notice several security guards and their locations throughout the facility. This operational view of security staff is critical to a health organization's goal of keeping their patients and staff safe. The dashboard is dynamic, and the reflected numbers change to correspond with what is currently visualized in the map. This helps an organization understand and visualize at-risk zones at any given time. Also, if we zoom out here, you can see there's a geofence surrounding the facility. This means that any device tagged that leaves our secure and visible perimeter, we can now be notified via an alert triggered by Indoors. Just imagine the possibilities of this technology. Having worked in the neonatal intensive care unit, the threat of infant abductions, or what we call code pinks, is very real. And on the right side of this dashboard, you could see a 3D visualization of the parking lot, as well as an analysis that shows us the blind spots that the cameras are not currently visualizing. This is also known as a view shed analysis. We can also connect real-time feeds from CCTV. Imagine that your camera detects an emergency within the perimeter of the hospital. For example, a real-life situation that I've actually experienced, a woman rushing to deliver her child didn't quite make it to labor and delivery, and the child was born in the parking lot. They called us in the neonatal ICU and told us to meet them in the northwest parking lot. We grabbed our equipment and ran. Needless to say, chaos ensued. Implementing an integrated system with a focus on location, the security operations would be able to quickly detect the closest security officer and notify them of this situation, as well as alert appropriate NICU staff to the exact location. The possibilities are endless, and the ultimate goal is to keep your facility safe and operating smoothly. Now I think we're going to have another poll question.
Yes, thank you, Georgie. That was great. For our third poll question, we would like to ask, of all the solutions just demonstrated, what do you think would be a priority for your organization?
Okay, poll is open.
Perfect. So we'd like to hear from you. Do you think that might be wayfinding, asset tracking and visualization, that capacity and space management we showed, facility management again, or like we just, Georgie just shared with us, safety and security concerns?
Okay. Let's give it about 20 or so seconds for everyone to get a chance to answer.
Yeah, perfect.
All right, we'll go ahead and close and share our results. So it looks like facility management, asset tracking, and wayfinding are the big winners here in the poll, but there's still some votes there for capacity and space management and safety and security. So
Great, good to hear, good to see. Perfect.
All right. Well, I am beyond excited to share with you that Loma Linda University Health is joining us on this webinar. Loma Linda University Health is a world-renowned hospital for so many reasons, and it only makes sense that they are a leader in implementing GIS into healthcare to provide whole person care to the communities that they serve. Loma Linda University Health is a beacon of excellence in terms of adopting innovative technology. This beautiful building that you see here is their brand new hospital. Not only will it be the tallest building in the Inland Empire, it will also be the easiest to navigate within. Please welcome Chris Olson, Loma Linda University's Health GIS Administrator.
All right, thank you, Georgie, Ethan, Jonathan, and thanks everyone for at ESRI for inviting us here. and allowing us to show some of the work that we've been doing at Loma Linda University Health. I'm really privileged to be part of this and show you guys all the great stuff that we've been working on. And even based on the last poll question, it kind of ties into exactly what we're focusing in on here. So I want to give you a little background on Loma Linda University Health, and maybe if some people are not familiar with us. We're located in the Inland Empire region of Southern California, and we operate 6 hospitals and over 100 clinics throughout the region. We have over 16,000 employees and 1,000 providers with a university system that also includes 8 schools and 4,500 students from around the world. The Inland Empire region, also known as the IE, has about 4.5 million residents and roughly occupies the area between Los Angeles to the west and Palm Springs to the east. LLUH has a long-term commitment to improve the lives of our patients in the Inland Empire and to equip future technicians in line with our mission to continue the teaching and healing ministry of Jesus Christ. We're founded in 1905 as an outreach to the Seventh-day Adventist Church and continue to this day to focus on making man whole, physically, intellectually, emotionally, and spiritually. LUH operates some of the largest clinical programs in the United States in areas such as neonatal care and outpatient surgery, and we're recognized as an international leader in infant heart transplantation and proton treatments for cancer. We're honored to host over 50,000 visitors a day to our main campus in Loma Linda, California. So
I think he got muted real quick.
Yeah, Chris, are you? I think you might have muted yourself by accident.
Oh, sorry about that.
Perfect.
Sorry, so we want to think about how we integrate some of the ways that our location technology into the hospital systems and some of the ways that you may not think of GIS coming into the system, but really plays a role in our patient system. So one of the ways that we do that is through our electronic health record system, which in our case is EPIC. We use location analytics to improve data-driven decision-making, providing insight to that data through the system and use the outcome to improve patient experience and patient care. I want to emphasize how important this is to us and to other healthcare providers around the country, because there isn't a lot of integration yet between GIS and the EHR systems, and Loma Linda University Health is leading that charge in innovating some of those seemingly disparate systems into each other. So we want to talk about how we think about the patient's day. You know, there's a lot of anxiety that patients have in coming to appointments and coming into the hospital, and we want to help alleviate some of those. So we want to think about one of maybe the most basic things is, where do I park? Where's my appointment? How do I get to there? How much of the day do you want to spend waiting or navigating? We want to think about the patient's total day experience. So to help with that, we have a few applications, and one of them that we use a lot and people around here use a lot is our parking application. This helps patients know where to park depending on the building that they're going to. As I mentioned before, we have 16,000 employees and around 50,000 daily visitors to our campus, so parking is a priority to us. But once they reach the parking lot, we want to think about the next steps in how do they get from the parking lot to their appointment. So they can open up their smartphone and navigate to that appointment using ArcGIS Indoors. This is an example of a couple of our buildings on campus. We help route them through the vast hospitals and clinics, which can save valuable time and improve the patient satisfaction overall. So the next slide here we're going to show is one of our employees who's navigating through the building. And you can see that he's going through one of our administration buildings, either navigating to maybe an appointment that he has or to a meeting. So we want to show how that's integrated with our systems, and we're actually using this on campus. And overall, we want to think about not only this, but how we route patients from their house to the parking lot, to the correct door that they need to go to, and then to the right unit as part of our complete patient plan. Another area that ArcGIS Indoors impacts us is our students. Each semester, our students fill the hallways of our campus buildings and hospitals looking for their classrooms or labs. Now, by nature, these students or young folks are inclined to open their smartphone first to find the next location to where they need to go. So we want to enable them to do this using ArcGIS Indoors to help them easily navigate and route to it. Another area that's important to us and important to you as well is asset management. So we've actually begun looking into this and including asset management as part of our indoor system. And to not only develop and help our clinical side, but also help our operational side to ultimately make the organization more efficient and safe. We're exploring ArcGIS Indoors to monitor and maintain various assets around our over 200 campus buildings. From fire alarms and sprinklers to medical carts and beds, we have an inspection team that goes out and checks these things every day to make sure that they're safe, available, and ultimately improve patient care. ArcGIS Indoors, it allows us to streamline these routes and brings up all the relevant room information, as you saw in the videos, to quickly allow us to keep the data moving and also keep it in-house as opposed to using other third-party systems that can store that information in black boxes. We can use ArcGIS Enterprise to enable our assets. We're also looking at ServiceNow integration within GIS to help route the technicians to the actual location of the issue, rather than just putting them in the room where it's located and reported, and then the team has to spend time trying to figure out where that is. For example, if a phone jack is out on the wall, we know which wall it is. If there's an issue with a light switch, do we know where that is? Think about, going into a waiting room. It could be a very big area. So you can see how there's a lot of time and money that can be saved by these precise reporting locations and incident routing between both ServiceNow and ArcGIS Indoors. Now, a lot of you guys may be asking, how do we get here? And we are here. So this is one of the example buildings that we have on campus. But how do we integrate that with ArcGIS Indoors and healthcare? So one of the things that you need to start with is getting your CAD data georeferenced and converted. Now, this is going to be the underlying foundation of how we develop these applications, both in ArcGIS Indoors and other systems around the hospitals and campus buildings. Like I said, we have over 200 buildings that we've georeferenced, and these are located throughout Southern California. They include many of our clinics that support all the smaller communities. Now, during this process, as a GIS administrator, there can be a lot of pain points. And this is the same for me as it is for somebody that might be in local government or any other GIS system. You might have issues of sharing data between different organizations and different groups. You may have siloing that way. There's also standardization issues, making sure that everybody's on the same page. You also have issues with GIS training. A lot of these people that are going to be using the systems are not GIS inclined and don't have a GIS background. So you need to think about how you deliver those applications, how you build those applications, and make sure that everyone is on the same page and that they get the most out of these great applications. So once we have these foundational pieces in place, then we bring in the ArcGIS Indoors capabilities, as we saw in a lot of those demos, and enable them for all of our students, our employees, and ultimately the patients. We have indoor maps on our campus that are set up for different areas. We have different divisions and staff that use ArcGIS Indoors to look at their administration buildings and employee maps and that kind of thing. And then we also have student assets like classrooms and labs and students that can navigate to where they need to go within the university buildings. And we also have kiosks set up that will help navigate visitors and patients to the proper waiting rooms and to doctors' offices. So in conclusion, at Loma Linda University Health, we see the transformative power in combining formerly disparate systems such as electronic health record systems and other non-clinical systems together with the tools from ESRI and other GIS applications to help optimize our costs and improve the overall patient and student experience. We see a lot of value in implementing the ESRI Enterprise and ArcGIS Indoors into our facilities to help improve the patient experience and decrease visitor and patient anxiety. So thank you all.
Wow, thank you, Chris, so much. And the entire team at Loma Linda, I feel honored to be working with you guys every week. And you really are a center of excellence within Loma Linda University Health. And thank you so much for sharing your experiences with ArcGIS Indoors. That's a valuable insight. And it's such great feedback. We really appreciate you joining us on this webinar. Thank you.
Yes, thank you, Chris. So to summarize what we've seen today, ArcGIS Indoors brings GIS inside buildings and provides wayfinding for people to easily locate assets in individual specific rooms. It supports smart buildings by mapping indoor floor plans and supports operations and asset management with integration with third-party systems. It's a complete indoor mapping and location system. So before we get to the Q&A, at this time, I would like to ask our final poll question. So we'd like to know if you would like to learn more and participate in an exclusive indoor mapping executive briefing for your organization. Please let us know here, and we'll be able to get in contact with you.
Okay, poll's open. Let's give everyone about 30 more seconds to answer. All right, we'll go ahead and close. And
All right.
looks like roughly 2/3 of attendees are interested in that executive briefing. Awesome.
Great. We'd like to set that up. We'll be in touch. And now we can turn to the Q&A portion of our webinar. So please enter your questions, and Christian will help us view those.
All right. Saw one come through regarding asset tracking and location. So one of the questions was, can they be tracked over time? And the example being IV poles here. So can you talk a little bit about that, Ethan?
Yeah, absolutely. So ArcGIS Indoors does include the analytic capabilities of the enterprise platform from ESRI. So that means we're able to actually look over time at historical routes on where these different assets have traveled. And we can calculate dwell time analytics. We can even view the proximity of these assets in relation to other things. So absolutely, you're able to leverage through a data store the ability to perform analytics on where these assets and where these things have traveled or been. So you do need a real-time location system, an RTLS system of some sort that collects that information and collects that data. But once that's done, we can access it. We can, of course, like you saw today, stream it to the map, push it to the map. You're able to view it in real time or on the back end perform analytics on it. So great question.
Great. And we saw a couple come in regards to Loma Linda. First one being, for patients coming to Loma Linda, do they need, what is the app that they are using there? So are they downloading ArcGIS Indoors, or are they downloading a Loma Linda app that's integrated with it? So Ethan, Chris, maybe one of you could talk up to that.
I can speak to it. Right now we're part of a pilot program with ArcGIS Indoors. So we are currently testing this in-house to make sure that we have everything the way that we want it. And then eventually we will roll this out publicly to everyone to be able to use.
Great.
Yeah, exactly. I can add on to that a little too. I see someone asked, do patients have to download that app? Do they have a login? So that native app, that's a native ArcGIS Indoors mobile application for iPhone and Android. If you go to your Google Play Store or your Apple App Store right now, you could type in ArcGIS Indoors and see that app. But if you download it, it require a portal connection. So it require the system to be stood up. So it's ideal and meant for all staff and operational use. So that's the tool like we showed with the ServiceNow integration. That's to incorporate wayfinding and other aspects of the platform for staff to use. What visitors are able to use, besides of course that kiosk, is they could access a mobile, on their mobile device, they could access a publicly shared web map that you create. So you would create different maps, of course, for different types of users. You would create a visitor app in this case that would not be the same. A visitor map in this case, instead of what you see in the mobile application that staff are using, a more internal map. So you create a publicly visible map, post that, make that publicly available. They'd be able to get some situational awareness from home if they're on their desktop, or from their mobile device, they're able to pull that up and they're able to view it that way. There's also other types of integrations that can be performed. We can integrate with existing applications that you might have. If a hospital system or university has an application already, we would probably be able to work with you. If you have developers, we can provide access to APIs to be able to integrate within your existing application a public-based wayfinding tool.
Great, thanks. We have time for maybe one more, and I see a lot more coming in, but they're very technical in nature, so we will answer those post-webinar as we dig into them. This question also related to Loma Linda and kind of the pilot program as a whole. And the question was asked if GIS professional services were used to assist in standing up the Loma Linda pilot. So maybe we could talk about the professional services and the pilot program as a whole, and just kind of give a little overview of that real quick.
Absolutely. I can go first, or Chris, if you'd like to.
Sure, I can speak to that. Yes, we did use, we've partnered with ESRI in trying to figure out how do you best use ArcGIS Indoors and how it's going to play a role in Loma Linda University Health, how it impacts our patients and employees and students. So we are part of the program. We're excited to kind of help drive and shape really the ArcGIS Indoors applications to kind of further those missions and everything that we want to put forward.
Yeah, absolutely, exactly what Chris said. And we do ESRI as a software provider and as a technology company have a full team of professional services experts that can help with the actual standing up of this type of system. So we also have partners that we work with that we can also work with you on to identify those workflows that are needed to be implemented so that the system can be deployed. So if we talk one-on-one afterwards, especially after that executive briefing, we'll be able to talk you through all the parts of what it takes to get started. Like Christian referred to, we do have a pilot program that we recommend getting started with. It's been really successful with lots of other customers, and what we're able to do in that is identify exactly the use cases and business workflows and challenges that you have so that we make sure we address them with the solution. So that's really the aim of the pilot. So we start with that pilot program to do that, to really identify those things before we roll out full production. But production systems are always the end goal after those. But yeah, we have a great plan, a great system for our customers, and excited to share more details with everyone later.
Awesome. Thank you for that, Chris and Ethan. I think with that, we have more questions coming in, but they are technical, so we will answer those post-webinar.
I love technical questions, so I
Yep.
will be excited to answer those. Yeah.
And then as a reminder, this is being recorded and it will be shared with you via email before the end of the week, so be on the lookout for that. So if you want to rewatch it and more questions come up, feel free to reach out. And other than that, I want to thank you
Yep.
all.
I have two more things. Just wanted to mention
Okay,
to everyone.
go ahead, Ethan.
Yeah, next week. Thanks for all the questions, also everyone. But next week, we'll be attending Autodesk University. If anyone on the webinar today will be there in Las Vegas, I'll personally be there. If you'd like to meet face to face, you can make an appointment at calendly.com/ESRI. And that's next week in Las Vegas if you'll be there. And then after Thanksgiving, December 4th through 6th, I'll also be in Salt Lake City. We'll be there as well. Other members of the ESRI team will be there. Love to meet there as well. You can also make an appointment to meet with us at calendly.com/ESRI. But other than that, thank you so much for joining, everyone. Each of our email addresses are listed here. Please feel free to reach out anytime with any questions. We're here to help. Hope to talk to you soon. Thank you.
Thank you, everybody.
Thank you, everybody.
Later.
Thank you, everybody.
Happy GIS Day.
Yep, happy GIS.
Happy GIS
Can't
Day.
forget.